welcome to another video. It's your girl Kwame Nacho with part 3 of my breast reduction chronicles. This video was gonna be out a bit sooner, but and I was gonna film it on Sunday, but then I got caught up blow drying my hair and then trimming it, and the day just slipped away. It slipped away because this is me with my hair trimmed, but it was a lot. So I didn't get a chance to film it anymore, and I do have to get into the habit of just filming content and having a backlog of content to edit, but may not have it. I don't have it. But anyways, having said all of that, welcome to another video. As I said, part 3 of the breast reduction chronicles saga. And already you know what to do: like, comment, and subscribe. Share this with somebody that is either interested in the process of doing it themselves, or know somebody that wants to do it, or you're just curious. Anyways, welcome to the gang. Let's see where I left off. It was on the 4th of December. That's where I had the surgery. I'm just going back to just see what I was up to after those days. Yes, yeah, got it. So I had the surgery on the 4th of December, as I said. And 1 second, because I am gonna get a compression bra. Okay. Two things I got. Okay, so I left. I'm a bit cold. Child, is my heating on? Yes, thank you. Act as if you're on, please, thank you. But okay, I left the hospital wearing a compression bra, which I am currently wearing. But they said to get either a sports bra that closes in the front so that I can rotate in between the wearing this one and then another bra. But I just got another compression bra in a size M, and as you see, it clasps in the front, or it closes in the front. And this one I use only when this one that I'm currently wearing is in the laundry. And then I am now 8 weeks post-op, and when I was 6 weeks post-op, I could start going to the gym again. And then I got this sports bra that is a bit more supportive than your regular sports bra. It has like a clasp in the back, but it closes in the front. And then it also has kind of like these things that you can, these flaps that you can adjust yourself to your own liking. I also want to say that the compression bra has the same thing, so you can kind of like adjust it to your own liking, because these are also loops and these are the bands, and it closes in the front. So that's what that's kind of like about what I would wear. Adding to that, as I said in the previous video, I also had some pajamas and tops that I would close on the front, just to make it easier, as to not lift my arms that much. I do have to say that pain-wise, for me, it was quite manageable. I had a fairly easy process, recovery. To be honest, I was following the pain scheme that they gave me, like the pain medication instructions that they gave me. the first few days, but it wasn't an unbearable pain as if I couldn't sleep. I think it was more a bit like discomfort, pressure in my chest. I remember the first days just breathing, like taking a deep breath and kind of like my chest expanding. I did feel that. I did feel the tightness, tightness of that. But it wasn't as if I had this unbearable pain. Nevertheless, I did get a prescription for diclofenac and tramadol, and then I also got like a stomach protector or a barrier for your to kind of like prevent the painkillers to really cause damage to your stomach. The first few days I had to take in painkillers every 4 hours, and I followed kind of like the plan that they had given to me. And then I started kind of like building it down because I didn't feel that intense of a need afterwards. And I also got 2 boxes of paracetamol because that was the basis. Like if the pain was manageable with paracetamol, I didn't have to take the tramadol or diclofenac. In the first days, I took the tramadol because I was like, okay, I have to follow this schedule, this thing that they gave me. But by Saturday, I started realizing that I didn't necessarily need the other heavy painkillers. So I managed fine with paracetamol. And I think in week 2, I did have some pain, and then I did take the tramadol because I had exhausted myself that day. Full disclaimer, and just kind of like, I wouldn't necessarily say TMI, but the first few days when I got back home, I also decided to start taking walks because the surgeon did promote and tell me, like, if you feel fit, go for a walk, just so that you can stay in like movement and just be active. And I remember the first few days, just every step I took, or if I would take an uneven step, I would just feel it in my boobs. I would feel it in the incisions. As I said in the previous video, I have an anchor incision. I have anchor incisions, and I would feel it under my right breast, specifically, because that is also the breast on which they took more out of. Oh yeah, relevant. They took approximately 800 kilos. No, sorry. It's a lie. 800 grams, almost a kilo, out of my chest area. So 300 on my left side and 500 grams on my right side. To even them out, the right was doing the most. She was an eager developer, so I was quite asymmetric, and I did ask for fairly some symmetry. In order to ensure that symmetry, they took out more from the right side. So yeah, that's also something that you can discuss with your surgeon if you want to achieve a symmetrical look. Some people don't. Some people are like, just reduce. I don't care about the symmetry. But I was like, child, while you're cutting me up, I was like, give me that symmetry. Give me that symmetry. Thank you. Thank you. As I continue. By Saturday, also something that had happened is that I was leaking out of my right breast specifically, and it was leaking a bit of like out of the incisions, a bit of yellowish, greenish fluid that concerned me. So I cut my stay short at the friend and I decided, nah, I need to go to the surgeon. So I went to the surgeon on Monday and they told me it was all normal because because I didn't have any drains, their excess fluid has to also find its way out, and that was fairly normal. In other cases, I've also seen that people put drainages, like the doctors put drainages. The doctors put drains. Yeah, the doctors put drains in each boob after surgery. The place where I went, they don't do that. So having said that, it was really normal for my breast tissue to just leak a bit. Then they recommended that I put gauze. So I just went to the ATOS and got these non-woven compression pads. So I put them on underneath the incisions because the first few days before going to the doctor, I makeshifted it with sanitary pads that I just, like those daily pads. I had a few in the house laying around and I was like, okay, let me put this until I go to the doctor. But the nurse said because the sanitary pad has a plastic layer underneath it, then that could promote bacterial growth. So I was like, child, no, stop. And then I asked my roommate to get me these, which came in handy. And then I started putting those under my breast until I stopped leaking. Okay. Something that really saved my life is this baby right here. This medical honey. Get you one of these. So this is medical honey antibacterial dressing. And this bad boy, really, it saved my life. And in that sense of it protected me from really just excessive wound. I wouldn't necessarily say excessive wound, but it protected my wound. It protected my wounds. Yeah. So, disclaimer, I didn't have big wounds or big openings at the T-junction. So what's the T-junction? The T-junction is the part where the anchor incision meets. So it is the flap on the right side of the breast, the flap on the left side of the breast, and the union with the rib part of your breast, so like the bottom part. So it's kind of like this T point, this point here where the ring kind of begins, and this would be the underside of the boob, and this would be the right side, and then the left side, and then here is the T junction. And that part is extremely sensitive in the first few days, weeks after your surgery. I cannot stress enough how important it is to be careful, to not do any sudden movement so that your T-junction doesn't rip apart or rip open, because that can set your healing back a few weeks. and you really don't want that. The experiences I've seen from women in that Reddit group that I'm a part of, it honestly, the things that they have gone through were quite scary, because when the T-junction opens, then it delays your healing. Sometimes you have to go back for a revision. Sometimes it gets infected, stuff like that. But thank God I was spared. Nonetheless, the stitches that I've got, the thread that the surgeon used was the dissolvable thread. So what that means is that your body disposes of them itself. It dissolves it dissolves itself, and sometimes you can have spitting stitches. So spitting stitches is that your body starts kind of like, those stitches start coming out, and that is also prone to infections or bacterial growth. Child, I applied this bad boy on it, covered it with the gauze. Gauze me say. Sorry, let me be serious. Gauze me say, and it healed that opening, or that beginning wound, in 2 or 3 days. I really kid you not. This isn't a lifesaver for everybody, because there are mixed reviews in the Reddit community, but I had small openings, small wounds that were manageable with this. So every time I was like, oh, this is gonna become a spitting stitch, apply this with my gauze, set to go, ready to go. I do have to say it itches a bit, because it is it's honey, and it's medical honey, so not safe for consumption, please. It really, you really feel it working. It closes the wounds fairly quick, and yeah, I just would then wear my compression bra, and it would just stay in place, and that's about it. So for regular wounds, get you one of these. Thank you. I think somewhere also on a week after my surgery, I went to the surgeon's office, and then they took away the steri strips, like the sterile strips that were on the incisions. And then after that, I had to just take it easy. And I laid in bed. I went home, laid in bed. Everything was fine. Everything went well. And I think by week 2, I started feeling that the incisions were itching. And I felt a slight discomfort. And that's where I realized it's important to start fairly early to hydrate your incisions. So then I went to the store and got myself this old and trusted cocoa butter from Palmer's. We all know this girl. She needs no introduction. She is always the moment, and she's a staple in every black household. I started massaging this on the incisions softly, just so that the incisions wouldn't dry out, because incisions do need moisture, and especially also because I'm sensitive, or I'm prone to developing hypertrophic scars. So that's also the reason why I got on this immediately. In week 2, every day since I had surgery, I started kind of like checking my progress, checking the incisions to see if everything was going well. And indeed, as I was panicking a bit if I'm gonna develop hypertrophic scars or not, I started kind of like documenting it. I think it is important to, in hindsight, take it easy, because and not to worry that much about the scars, because at the beginning I remember feeling some of the scars and they were fairly raised, but it's just the incision, so it isn't a scar tissue yet. So it is just the incision where the doctor did his or her work, and it feels raised. So I had points where I was really concerned that they were turning hypertrophic, and I remember the nurse from the surgeon's office was like, give it time. It still needs to settle because it was swollen. So that's also one of the reasons why the incisions felt raised, but they weren't scar tissue yet, if you kind of like understand what I'm saying. Now, 8 weeks post-op, the 8 weeks post-op, the incisions that were raised at the beginning have flattened out fully. So of course it was 2 weeks after the operation, so of course they were still a bit sensitive and raised and thick, and now they are fairly flat. Things I also got, there is to aid in my sleeping. I think that one is a good one. To aid in my sleeping, I bought a pregnancy pillow because I was not allowed to sleep on my stomach for the first 2 weeks, and honestly 8 weeks post-op I'm still not sleeping on my stomach because I find it a bit uncomfortable after a while. And now I don't miss sleeping on my stomach. I'm a reformed stomach sleeper, and so now I sleep on my back with the pillow, the pregnancy pillow, which is like a U shape, and then I have the U part, like the bottom part, on my neck, and then the other parts are like on my side, and that has helped me a lot to just sleep upright. Also, in the first few weeks, I couldn't sleep like laying flat on my back. I had to kind of like sleep in a bit of more of like an upright position, because even sleeping on my back was quite uncomfortable. So I also got some sleeping tablets, or anyways, this is a bit more natural. It isn't melatonin. It's a bit more natural, just kind of pills that make you feel a bit more sleepy, and it has helped. I didn't use them a lot because sometimes I would just fall asleep and on my own, but I did notice, I think it was somewhere in week 3, that I was oversleeping on my back, and I had a bit more of issues just falling asleep in general, and that's where kind of like these pills came in handy. Something that I also got are arnica tablets and arnica gel. Some people swear by them, some people don't, and I was like, man, it doesn't, like, it can do no wrong. But some surgeons do prescribe them, or like tell you to get them, just because they help with swelling and inflammation. And I was like, okay, well, let's get it. So in the beginning, I took like 3 per day or something, spaced out, of course. And something that I do get is irritation and dry pimples from being under general anesthesia. Some people get it, some people don't, but I have sensitive skin, and something that I do notice after being under anesthesia is that my skin tends to become dry, and also then I get these kind of like dry pimples that itch and are a bit irritated. And something that really helped me was to put the arnica gel on it, and that helped a lot. So that was that for the kind of like the pimple side. And I want to go to scar treatment because I think I've covered everything. Oh yeah, maybe important nutrition wise, I ate a lot of pineapple, ate a lot of healthy fruit, a lot of salads, but that's also just how I eat regularly. I don't eat a lot of fried food or processed sugars. As I also said in the previous video, I don't necessarily consume alcohol. Like the only moment that I consumed alcohol during this whole period was on the 31st of December, just a few sips of an alcoholic beverage. And other than that, I don't drink a lot of alcohol, so that also contributed to the healing process and just me feeling fairly fit. I also consumed a lot of proteins because that also aids in recovery. And you know, if you go online, you can find diet plans or things you could eat to promote recovery after surgery. They say pineapple is a good one. I just love pineapple, so I had a lot of pineapple during that period. A lot of juices as well, stuff like that, and it helped. Also, you will be bloated in the first weeks. I remember getting off of surgery and being like, oh wow, is my stomach bigger? What's going on? What's happening? Ciao. But I was bloated. Weeks later, I'm fine. It was just the bloatedness. So that's something to take into consideration. But that will also pass. So yeah, going to the scar treatment and things that helped me, especially with attention to hypertrophic scars and keloids. So in the Reddit community, somebody said a massage gun is handy. And I bought a small face massager thinking like, okay, this might do. But honestly, it didn't do anything. So I moved on to this bad boy. This is my roommate's, God bless her. And I used these 3 heads. So this head, this head, this head. So I'm gonna show you the pressure of it. Yes. It's kind of like an air pressure massager. And I'm just gonna show this, but I honestly just put it on the incisions when I knew they were closed. Don't put it on any open incisions. Use your brain, use your thinking cap. Thank you. But when the incisions were fairly closed and over my clothes, so I would just massage it on the incisions, especially here, to break up the kind of like the forming of collagen. So I'm gonna read why do hypertrophic scars form. So hypertrophic scars result from an overproduction of collagen, a structural protein crucial for wound healing. An imbalance in collagen synthesis and breakdown during the healing process leads to an accumulation of collagen fibers, causing the scar tissue to become raised and thickened. So one of the things that helps in breaking up the forming of hypertrophic scars is massaging. And it says, scar massage may be effective to decrease scar height, vascularity, pliability, pain, and depression in hypertrophic burns scarring. So it does help with flattening and softening the scars. Child, when I read that, I was like, massage gun to the titties. Yes, okay? Because I was like, ooh, I need it by today. So I spent practically every day still massaging it 2 minutes on each side. So 2 minutes on the right, 2 minutes on the left, just going back and forth, massaging this. And what I do like is with this one specifically, I had the point to kind of like really get it there. But why is it also important to massage your breasts? Is to prevent things such as fat necrosis and hematomas. So hematomas are a collection of blood that pools under the skin. So it gives like you can feel like a lump or something that's hard under your skin. And this can happen sometimes because breast reduction surgery is nothing. You're removing, the area is quite sensitive for a few weeks, so anything can set off your body from just having a hematoma. And in the week of, I think around the 21st of December, I went out of the house and I exhausted myself. And when I got home, there was a hard lump on my right side, on my right boob. And I was like, is this a hematoma? And I was like, oh, well, I took the massage gun and I went ham. It did hurt. It was quite an uncomfortable feeling, but I knew it was a manageable pain, and that really helped with preventing that hardness from becoming a hematoma. Because if in some cases, and you might have to go to the surgeon and have them cut it open and drain it. And mind you, this is what worked for me. This is what helped me. I don't want to be like, oh, this is what you should do. This is what helped in my case. So using the massage gun really saved my life. And as I said, I've been massaging my boobs ever since. I think around week 3 or something, when I knew the incisions were fairly closed and that I wasn't at risk of opening the T-junction. Also, in that part for the T-junction, I didn't massage it directly. As I said, on top of my clothes, I would use the massager. I didn't do the skin massager to skin contact, just to be sure and be safe, which I recommend. I also got silicone gel, which I started applying as early as I could. And then I got this from Bepanthen. It's a scar gel and it has a roller underneath. So roll this first on the incision and then I would apply this. And I also got this Rejuvasil silicone scar gel, liquid silicone. And also the Scar Esthétique, which is a scar cream with silicone. And I stayed far away from high grading silicone. So these are just over the counter, fairly usable, fairly manageable silicone gels. I also did patch testing because some people are sensitive to silicone gel and they can irritate the skin. So I did a patch testing first here on the inside of my elbow. Very important, do a skin patch test before applying anything to your incisions. Like, please, I beg of you. And when I saw I wasn't reacting adversely to it, I decided, okay, it's a go. So I have been applying this on and off in combination with combination. Every time I say the word combination, I have to think of that meme of that artist. I don't want to name him, but combination. If you get me, you get me. You know, if you know, you know. And then I also got this silicone tape, soft silicone tape from Meptak. And this I cannot pronounce. Child, I won't even try. Monlike. I did try. I failed, I think. But so this silicone tape is not advertised as a scar tape. It's just advertised as a tape that you put on in combination with gauze if you want to make your gauze stick. But this tape is known for in kind of like in the surgery community, people that have had surgery in the scar community, is known for reducing scar appearance and of fresh scars. So once I knew, I think by week 5, I started putting this on my incisions. And at some point at my anchor incision on my right breast, I started noticing the kind of like the growth of a hypertrophic scar. And I was very concerned about it. I was like, oh, this isn't going away. I hope it doesn't expand further. And then that's when I started using this. Because I had bought it, I think about approximately in week 3. But when I read the instructions, I thought it was just a regular silicone tape. So I didn't use it. But by week 5, I went again on the Reddit community and people were like, I know it isn't advertised as a tape specific for scars, but it really helps. So then I applied it to my incisions, and I kid you not, for me and mine's, it reduced the development of the hypertrophic scar that I was having. And now what I do, I use it on my anchor incision, I use it on the T part of the incision, but I also cut it in smaller strips for the incisions around my areola. So this has really helped me a lot. And I also in panic bought this firming cream because my body and my skin, my breast tissue was peeling. Well, not my breast tissue, my breasts were kind of like peeling, and I think it just has to do with something that they used, you know, like the antibacterial fluid that they use while operating you. And my skin started kind of like peeling as if I had, as when you go to the beach and then you start peeling. So then I bought this firming cream, but to be honest, it isn't that necessary because the CeraVe does the equal amount of work. So you're also fine with a CeraVe. And this is no scent, fragrance-free as cream. I also in the first few days showered with a fragrance-free antibacterial soap, and that also went well. I think in the first week, if I showered, I avoided my breasts because I was still a bit scared, and then I would just take the kind of like these wet wipes and just cleanse my body in that way. But after a few, I think by week 1.5, I started showering regularly, just letting the water just run over my whole body. But yeah, I think that's kind of about it when it comes to post-op. As I said, I'm now 8 weeks post-op. These things have helped me along the way. Also being in good contact with my surgeon, or at least the office, and being able to present every question that I wanted, every concern that I had, is also a great help. And also the fact that I was part of that Reddit group that really gave me a few tips, because the Medi Honey, for example, I got that from the Reddit community, and the Mepitak tape also got that from the Reddit community. And also the tip to use a massage gun I got from another black woman in the group who also has an issue with hypertrophic scars. So that's about it. Yeah, thank you guys for watching. I hope this video found you well, but I hope this video has been quite informative. And I will be also making another video where I talk about the about my mental health and the breast reduction surgery, because it is something that I was quite confronted with after having the surgery, and it is something that in the community people also talk about. Things like body dysmorphia, accepting your new size, the anxiety that comes with, you know, monitoring that the wounds heal well, or that the T-junction and the incisions heal well, and also anxiety for things just as scar development, scar tissue development, and stuff like that. It is something that you shouldn't take lightly. But having said that, I hope that this post-op part, gave you a bit of insight in the things that helped me. Again, disclaimer, this helped me. If you ever do this surgery, please follow the instructions from your surgeon first and foremost, your physician first and foremost, and you know, do patch tests, do what works for you, because I think that's one of the most important things. This is a very personal, very private, very catered to you procedure, you know. So what works for you, and what works for me works for me. Of course, there are things that we can share and things that, you know, we can learn from each other, or can help each other with. But as I said, this is a very, very, very specific journey in case you ever want to do it, and in case you're ever interested in doing it. So yes, having said that, I'm gonna check out. I'll edit this video and upload it, and then I'll see you in the next video. But you know what it do, like, comment, and subscribe. It has been your girl Kwamina Jo, and I hope that wherever you are having a beautiful and blessed day. Bye.